Haley and I wanted to take this time to talk a little bit more about the overall culture and community here at OSU. I think what's important for both of us that we noticed at OSU that's different from other schools is that once you get an interview, your personal statement, references, and GPA, those are put to the back burner, and what's important is how you respond and how you interact with the proctor during the multiple mini interview. And those are clinical and ethical scenarios where you're asked to think out loud and respond.
Yeah, and I think for me, thinking back, there wasn't really a right or wrong answer. It was more of playing on experience and talking out loud. So thinking about them wanting to hear your thought process and your way of thinking.
Absolutely. Yeah.
And then that really makes me think about the program as a whole and the culture and the curriculum so far. So as a second year, I think back to the first year and even what I've done so far in my first semester as a second year with role plays and case presentations. It gives us an opportunity as a cohort, both first and second years, and even faculty, to hear interesting cases and collaborate with one another in a more natural environment. So not really competing, but hearing each other's thoughts and experiences and comments.
Yeah, and even before we both started, we were paired with what's called a Chromie Homie, or a second year student, where that's somebody to lean on and get more used to how the program can interact and what to expect in our years as genetic counseling students. But also throughout the program, we are paired with program coaches and mentors along the way that truly want to see us succeed, because at the end of the day, in 2 years, we're all going to be each other's peers. So
yeah, and so definitely a very good support system throughout the whole entire program in 2 years, which really helps with how I've learned and I think just experience in general.
Absolutely.
Hi, my name is Nicole Mollis, and I am a first year student. There are some features to our curriculum at Ohio State that are pretty unique in their ability to help us as we become genetic counselors. One of the first great aspects of our curriculum is the flipped classroom. For example, we have a flipped classroom in our practice-based learning class, in which we learn most of the material outside of class, but then once we get into class, we're practicing role plays with our fellow classmates. This gives us a good low-stakes opportunity to practice communicating with patients. Another unique feature of our program that is really helpful is the fact that our curriculum is mirrored. So this means that we see key concepts multiple times in different classes. For example, after we learned about chromosome translocations in our genetics class, we then got to practice explaining that to patients in our practice-based learning class. So the opportunity to see material in multiple situations really helps us make a firm foundation for our knowledge.
Hi, my name is Shantiara Johnson and I'm a second year student. While the first year's curriculum heavy, we do start fieldwork placement during the first semester, in which we observe GCs in various specialties. In fieldwork placements, students are able to use basic skills such as taking a family history or contracting as they become more comfortable in their training. This can help reinforce the learning and build a foundation. By the spring semester, students are typically more confident and comfortable. They're able to take on more active roles in clinic and can facilitate most of the genetic counseling session, if not all of it. This exposes students to a wide range of specialties, which allows them to have many job opportunities due to their rich fieldwork experience.
And we wanted to take the time to talk about thesis and research at OSU so far. And I wanted to start with talking about how I had a general idea of what I wanted my thesis project to be. In the first semester of your first year, Ohio State puts together a thesis research mixer where we can collaborate with other people in the field, other genetic counselors and doctors. And I use that as an opportunity to stick with my first idea of what I wanted my research project to be, which was psychiatric genetics, and I used that as an opportunity to think about who could be on my committee and also my advisor.
And I took that opportunity to see what ideas people had in the field and what current research was happening, and just get more ideas and more comfortable with what I might want my thesis project to be.
Yeah, and then right now I'm in the process of writing my manuscript, and I think back to my first year and how they really put it in our ideas and motivate us to publish and do something with our research that we spend so much time on. And I think that really provides us a good opportunity to become leaders in our field, and also for potential future careers and research opportunities in the future.
Absolutely.
Thank you for watching our video about the Genetic Counseling Graduate Program at The Ohio State University.
As you can see from what we've talked about in this video, OSU has offered us with unique experiences that have aided in both our professional and personal growth.
Applications to apply to the program open up on September 1st, and the general application is due on December 31st. We also have a fellowship opportunity, and that application would be due on December 1st to be considered.
If you want to reach out to learn more, or opportunities to attend our seminar series or talk to a current student one-on-one, please reach out to Ohio State GC program at osumc.edu.